You struggle with impulsivity or emotional reactivity, whether or not you're medicated for your ADHD, you need to know about this medication. Today, we're going to talk about atomoxetine, aka strattera. In this video, I'm not only going to explain how atomoxetine, which is a non-stimulant ADHD medication, works, but save this video and share it with people you think would be interested, because I'm going to provide must-know information that you should talk to your doctor about before considering this medication. Atomoxetine works differently than other ADHD medications because it is a class called SNRI. It inhibits norepinephrine reuptake. I'll explain what that means. And the cells in our brain release norepinephrine, which helps us to focus. That norepinephrine moves across what's called the cleft. Here's a presynaptic neuron, postsynaptic neuron. This is the synapse. This is the space that norepinephrine binds and helps to relay a signal, which lets us relay information across our brain. Atomoxetine blocks the reuptake, so it blocks it from going back up, and so it stays here longer so that there's more likely a propagation of signal to the next neuron. It's really specific for the prefrontal cortex, and if you know about ADHD, you know that we struggle with prefrontal cortex signaling. Because it has this non-specific action on norepinephrine transporter that also helps to reuptake dopamine, it selectively increases our dopamine levels as well in the prefrontal cortex. This is really good for helping us with things like impulsivity and emotional regulation without driving any motor or reward related areas. It actually provides an extra level of safety with atomoxetine, where it has a lower risk for addiction and dependency. This medication does not work instantly. You need about 2 to 4 weeks to get its full effect and decide how it's working for you in your body. Here's the part that most people don't know about this. Because atomoxetine is metabolized with this very specific enzyme, which is referred to as a highly polymorphic gene, which means that there are so many different types of this amongst the population that we have to divide this into 4 broad categories. People who metabolize this medication really quickly, which are called extensive metabolizers. There's poor metabolizers, and then there's intermediate and ultra rapid metabolizers. So we need to assess what kind of metabolizer you are, because this is going to affect the levels of this drug in your body. If you metabolize atomoxetine really quickly, you're going to have levels that decline too fast, so you're not going to feel like it's working for you. Versus if you metabolize it really slowly, you could have an accumulation of this drug in your system and then have higher adverse reactions. It's really important to ask your doctor about measuring plasma concentrations if you are experiencing different symptoms. If you want to learn more about managing your ADHD in addition to your ADHD meds by creating systems, comment systems below and I'll send you more information. Follow me if you like learning more about your neurodivergent brain.